started my basically being a radiologist, and I was more into this one. And I always try to look at the causes of the disease. I just feel that it is not just to treat the symptom. I should properly know what is the cause, then I can go ahead. So that's where I started my journey. I still am. I think my son has got, at least he's almost, I cannot say he's totally recovered, but okay, what the other people they say that makes me happy. I feel he's about 70 to 80% recovered. And so along with that, I want to pick up from what is the, to be very, very frank as such, over the 5 years, what I have done, over the 4 years which I did my preparation, autism study was more difficult for me. Autism involves all the systems. You have got neuroendocrine and everything and all that. GIT is involved, so much things and all that. So what autism has taught me, and I slowly started integrating with the other things also. I started seeing most of the problems. Now the basic problem is the oxidative stress. I'll not go deep into this medical jargons and all that, but I just want to put you about this is an environmental issue. It's a kind of environmental medicine. We need to look at out-of-box solutions. The present day mainstream medicine, I don't think they are ready to leave alone understand that they cannot handle this kind of illnesses at all. There are so many issues which are involved. So slowly I started with my other things. I started treating fibromyalgia. I started treating rheumatoid arthritis. Now I give almost multiple sclerosis is one thing I'm treating now. It's so easy for me. Once I have checked out with autism and other things and all that, it's very easy. We take cardiovascular disease. Cardiovascular disease, I just try to see. These are now the things are very, very simple for us. We are looking at the causative factor of the disease. We used to think, okay, like even my dad used to ask me, okay, I'm not a smoker, I don't drink alcohol, I don't really take my vegetable diet and all that. By the time he has got atherosclerosis. Atherosclerosis is cardiac vascular disease for life. So after, like, I was so stupid, I never answered that question. Now there are most of people, they are Brahmins, people are coming, the people who have never smoked in their lifetime, now they are lung cancers and all that. So I feel this is a relevant thing, but I embarked upon this particular clinical medical toxicology, and with that we do something called radiation therapy. Try to do. I'm somehow trying to work up still. I'm just trying to see how best we can integrate this metal toxicology with radiation therapy with other modalities. I try to see my site as well, and we just I think that we need out-of-box solutions for almost all the days. So diabetes is such a tricky thing here. In Hyderabad, we are going to become we are aware of Hyderabad, we are aware of India, all of the US. We are going to become a diabetic capital. I'm not going to things to get it so easily as well. We have got our genes and all that. We have predisposition for diabetes. But if we can control these environmental factors, like if we can control the bisphenols, I'm doing something for diabetes. And we try to take out arsenic from the inorganic arsenic is also one of the problems. So all these things, we need a holistic approach, right from the diet. Diet is so important. Diabetes, and I'll be talking about this also. So,
Dr. Saxena, sorry I'm cutting you, but your voice has to be a little more audible. We have almost 10 people joined in now, and I'm going to change you to a presenter. You can accept it.
Okay. Yeah.
Yeah, I agree with you, Manisha. Your voice is quite clear, but not Dr. Saxena's.
Yeah, I think you might have to be
Is it okay
talking to
now?
the mic, maybe
Yeah,
loudly.
Yeah.
little better, Dr.
Is it
Saxena.
okay? Okay. I hold the mic with the. Yeah,
Little
that will
better,
be easy.
but Manisha's voice is quite clear and audible.
Because
But
I'm talking,
we
Okay.
are,
Okay. Okay.
yeah, I'm talking in the mic. What will happen? I'm worried like this is so informative, and
yeah,
you are really not talking it not only from a doctor but from a parent perspective,
absolutely.
and it is such a wonderful. I mean, what you're telling is absolutely right, and we have I think one or two more doctors joined in, and I really want them to listen.
Absolutely,
Whatever,
because I agree. Whatever Dr. Saxena is saying, I do agree. Absolutely.
yeah.
Yeah, all these
This
things
is
are. Yeah.
autism is new, and Dr. Saxena, you can also put up your screen. I've already put up. We have almost
Yeah. Yeah.
11 people joined in.
Yeah.
So I think we can start, and at the end of the seminar, we will take the question and answers.
Yeah. Manisha, just one thing. I need to. How do I had to load this PowerPoint? Like
Yeah, just
PowerPoint
load it.
presentation.
I can see, everybody can see your screen.
Yeah, we can see the PowerPoint, Dr. Saxena.
Yeah, so just start the PowerPoint.
Sure.
Yeah, don't pull up any bank accounts and all, because we can see everything now.
That's good. I think this is the one thing. This is the first. Shall I start?
Yeah,
Or
just
you have any?
close everything and just put up your PowerPoint thing.
Okay. That's okay.
I'm also recording the presentations, and I'll be making it available to everybody on Autism India, and everybody can listen to this presentation. We also have Dr. Deepak Gupta as our second presenter. So after that, your questions can be answered.
Manisha, shall I start with that?
Yeah, just start. Only talk in the mic, whatever loud you could.
Okay. Yeah. How is it audible?
This is better now.
Okay.
This is much better.
Yeah. Let me thank the organizers. Let me thank Manisha and who are involved with the Sakil or the foundation and all that. This is a stupendous, very fantastic thing as such. I hope this should have been there in when I started my journey. So I'll be talking about something about food sensitivities, and the way this is more pertinent not only for autism. We need to, for our health also, we need to look into some of the issues which I am going to highlight as such. This is one thing I'm always trying to figure out from my MBBS days. I used to always get down with my sinusitis and allergic colds and all that. Well, now I'm able to figure out why exactly I was into that particular thing. According to the Times of India report, we are now picking up more food allergies and all that. This is slightly frightening as such. The kind of peanuts, the kind of things which are involved here as such, and there is no authority. Like you cannot put it on the paper. These are the things which this food contains as such. So the people are working for now, so that we need to put the nutrition facts. What are the things which are there in that? I think this will go a long way, particularly for people who has got food allergies and all. The thing is, what happens in our part of this part of the case is, people will be having food allergies. They'll be suffering with that, and the thing is, it happened with me as a medical student. I used to have chronic rhinitis with scores of sinus problem and all that, and I never figured it was purely because of allergy. Now I don't take any. I had taken antibiotics for maybe for like I had of at least 8-10 days in a month I used to be on antibiotics to see that my sinuses are better as such. So I had really paid a high price. Now that my gut intestinal tract is in such a shambles that particular time. It took me a long time to see that my gut has repaired. So what I'm trying to put across is it is not just for the autistic kid, it is for you also. You need to look into these other issues. Coming down to what are the allergic foods, what are the basic allergic foods? Wheat is number one. I put it across wheat, then the milk, then the corn, then the caffeine, uh, and the nuts. Nuts means all of the nuts as such, and citrus fruits. In our part, we use tamarind a lot in Hyderabad. Everybody takes your lentils, dal, and all that with tamarind. It makes you crazy, you know. If you have got this allergies and all that, I'll try to put across. These are the main kind of allergens, and whoever patient comes to me with either asthmatic problems or whatever is in all that, believe me, I cut out these products, and there is 70% of the time, 70% they start feeling better as such. They don't go into problems. Most of the alveolitis, small children with problems as such, the hospital admissions are getting lessened if you stop these particular things as. Uh, okay, this is the kind of thing. I'll definitely, you people must be, all of you are much aware about the role of or milk-free and gluten-free diet in autism. What I just try to emphasize is, again, we need to avoid sugar, we need to avoid refined starch. Refined starch is it's a big game as such. Refined starch, it takes, the problem with the refined starch is you are, with sugar and refined starch, you are allowing yeast into your system as such. Yeast is one thing which is a kind of normally our intestinal tract has got good bacteria, has got bad bacteria, has got good yeast, has got bad yeast, and there is always a symbiotic relation with this. Whenever this balance goes off, I have not seen anybody, I have not seen last maybe 1 or 2 years thing, I have not seen anybody with good kind of thing, be it for any kind of patient, be it cardiac patient, diabetic, everybody has got a gut issues. I don't know how we have to take care of this particular thing. Apart from, so I'll again go back, apart from avoiding milk, avoiding wheat, avoiding soya, please avoid sugar, please avoid refined starch. Most of the refined starch, these are all the convenience foods which has caused us the problems. The second son still loves Maggie. Now Maggie at least is coming in the more complex carbohydrate thing as such. They are
Whole
just
wheat.
trying to,
Yeah.
yeah, whole wheat Maggie is coming. At least I was happy. So these are the things which are causing us a lot of problem. When you have got gastrointestinal issues, absolutely, you cannot jeopardize your things by allowing this particular thing. We need a high fiber diet. It's a must, and we need good antioxidants, turmeric, garlic, and all that cruciferous vegetables, whatever we are using it here. It really that they serves a lot. What happens with these cruciferous vegetables and all that? You are getting good kind of, there's an amino acid called glutamine. You take cabbage, your cabbage juice or whatever is it. This glutamine is a amino acid which is concentration is high into this one. So this glutamine is making your intestinal cells more kind of, it takes you, the intestinal cells are more healthy with this particular thing. So I try to I supplement not with glutamine in the form of powders and all that, But this is a natural glutamine, what you are getting from this. Turmeric, garlic, you people all know everything about that. Garlic is garlic, and so many things. Yeah, preserved foods and things is the thing which slowly in Hyderabad around, people are coming up with shops which are organic now. And I see there's a great future. I'd like to invest into this will be a good business prospect for me.
Dr. Saxena, can you little bit talk more about refined starch and the whole, like, what is the difference between
The refined starch, I'll try to put across. The refined starch is the number one. We just go to any kind of restaurant. We order sweet corn, chicken corn soup. What is corn soup? It is basically refined starch. The moment it goes in, refined, this is the one thing which is refined starch. It is making all maida products. What is maida is basically, I think most of you know, it's a refined wheat, grounded wheat, this whole wheat kind of thing, and it's a very kind of thing. What happens with this refined foods is, the moment it gets into your system, okay, everything it's so it is there, these carbohydrates, and they are not complex, they are very refined, they just get into the system. It's not it is very easy, they cross the intestinal barriers, And the other part is, it is not just that one. This refined starch, they are feeding the intestinal tract. You have, along the lining of the intestinal tract, you have bad bacteria, you have yeast and all that. And they thrive on this one aspect. Refined starches can be anything, like whatever sweets and all that we are taking. The things which is having the sugar, refined sugar. White sugar is refined sugar.
So you can say anything which is white or anything which is processed, In back in our childhood, our grandparents, they would have never eat refined. They will just eat it unprocessed.
Absolutely.
Okay.
The thing is, whatever rice we get here in Hyderabad, the thing is, all are polished rice, we don't get unpolished rice here. The thing is, this is a huge kind of thing. We need to depend on a place from outside the Hyderabad to get the processed food, unprocessed food, which is rice, which is called dumpud BM. It is made from the hand as such. By the rice, you have got the kernels of the rice and all that. Everything is so. What I feel is mostly the rice, even the wheat, atta, whatever you are taking is all refined, all things and all that. Corn is a big kind of thing, and absolutely white sugar as such. So refined starch is not good for anybody. Not even I take sometimes, but for a long kind of thing, I will try to avoid all these things. It doesn't suit me. I'll go to the next one.
Yes, please go ahead.
When we are coming to autism, what are the other things we need to avoid? We have already talked about milk, we have talked about wheat, we have talked about soya. Other things we need to avoid is caffeine, monosodium glutamates, this NutraSweet and sweet saccharides and all that. There's a lot of ad campaign going on here. They say, okay, the thing is, it's absolutely no sugar substitute is good. No sugar substitute. You can absolutely go back to your thing called jaggery. Jaggery is the better one. And the second best thing what I tell the patients is stevia. People are still not comfortable with stevia here because of the taste, but I feel stevia should be a very good alternate for sweet, this one, sugar. Food dyes what we are using, yellow food dyes, nitrites, sulfates, glutamates, these are all preservatives we need to totally avoid. What happens when we are adding these things in your food and we are taking it, these excitable toxins, the people already in autism kids, we have a low threshold for fits. we have low threshold. The thing is, what I mean to say by low threshold of fits, somehow fits are a symptomatic thing. I have my autistic kids who has got who are had fits and all that. I tell the parents, see, this is the threshold. We need to see that if we can avoid this kind of food and this particular things, we can increase the threshold. Because what happens with the lowest trigger, this guy goes into a fit. As a doctor, I feel that everybody has got a threshold. I can make a normal person go into a fit by giving him ECT. ECT is electroconvulsive therapy. We give some kind of electrodes and all that. We raise the kind of thing. And once this causes, then the person starts showing the fits. A person who has got hypoxia, low oxygen levels, and he starts showing fits. Why? Because this threshold is reached there. In autism, I say the threshold is very low. Even a small kind of fever, this poor chap will go into he will throw the fits. So we need to be very careful. I always think my patients are categorized. This patient has got this kind of thing. I take extra precautions in them. We need to educate a lot to the parents about this particular thing. And I'm coming down to what are intake of phenolic foods. The thing is, the funniest part, an apple a day keeps a doctor away. It doesn't serve here.
Exactly. I completely agree with you.
Absolutely. There are a lot of people, even I fall into that particular thing. You must have seen some people having the dark circles underneath the eye. Have you noticed anybody? And you tell, okay, yes, that's where I didn't had a sleep yesterday, and oh, my hemoglobin is very low, and they keep these poor people. They go to a dermatologist, putting across some creams, and these people, the farmers, are making a killing of that.
Exactly.
I see so often this is a sign of phenolic intolerance. This is called PST intolerance. If you have PST intolerance, avoid these grapes, apples, and strawberries, and see the results as such. Yeah, our kids, autism kids, you cannot give them all these things. You need to limit the copper also. Copper, why you need to limit the copper? These things, copper is always high in autism. Zinc is low. We need to create a balance between. If we have got low copper and high zinc, the body's these two things, parameters, suggest what is the kind of excreting capacity this guy has got. Okay, we just try to check copper and zinc from the hair assets. And the moment this is done, we know, okay, this is the copper levels are high and zinc levels are low. We know that these capacities, exceeding capacities are limited. We need to give him more detoxification. We need to give him more chelation and all that. So absolutely, chocolates are absolutely no. I don't take chocolates. Even I think I have got some allergic issues. I don't take. Coming down to years ago, this is of I have always salute Andy Wakefield.
Yes.
Kind of work he has done as such, blood-brain connection, autism.
And I also want to
Yeah.
cut off here a little bit and add about Dr. Wakefield. He had to pay a heavy price for that, but still he's still doing a phenomenal job there.
Yeah, I think these are all the Manisha, I place these people into a givers as such. Society is composed of givers and takers.
Yes.
Dr. Andy Wakefield is the giver, is the big giver.
Yeah, and he had to sacrifice his...
He never bogged down the kind of work what he has done.
Yeah.
What this guy has done is he has seen this connection between the intestinal. He has coined the term autistic enterocolitis. He has biopsy. He has done colonoscopies of about 8 to 10 kids and got some biopsies from them and showed that the measles virus, persistent measles virus, this kind of things and all that. And he's still an outcast in the mainstream medicine.
Yes.
Western medicine people, they are still taking him as a kind of enemy number one.
Enemy number one, and
I,
he's having a lot of court cases too. There's a case going on
court
against him.
cases also.
Yeah, and he was
The
banned
thing
from
is,
the London.
yeah, he has to leave this kind of job from London, and now he's in which place I'm not sure, but he's
I
in
I did
States
get an
only. Yeah.
I did get an opportunity to meet him personally in when I went to the conference. So I met him personally.
Yeah.
Yeah.
Okay. Great. Great. So what he has done about this gut derived chemicals, lipid metabolism, and all that, everything is, you should see one of his talks and all that. He has got wonderful slides about how things goes and all that. I had seen his webcast quite a number of times, and I got inspired a lot. These people also, they need to mention Cal Richard, Robert Cade, and Pal Shutter. Pal Shutter, hats up to this guy. This guy was
Yes.
the first person. He showed milk is converted into casomorphin. Casein from the milk protein is getting into casomorphin. This child of autism, what he's doing is, he is taking out milk. From milk, he is deriving some morphine-like substance. And once he is with morphine, he is in his own world.
Yes.
He doesn't is bothered. Same way, gluten, he forms glutamorphine acid. And both these things are so addicting. You call him number of times, he'll behave as an opioid addict. Okay, so these are fantastic people who have done a great work and all that. What the main essence was, the kind of brain growth and behavior is directly influenced by the gut. You have got a brain, ANS. I think is you have got direct connection. Gut and brain, you have got a direct connection.
Our Ayurveda says
So,
that. So we don't need studies. Our Ayurveda says that, right?
yeah. People say keep your gut healthy, everything will be good. That is a thing I realized even long time ago. Okay, the thing coming out to the gut access, I have a small questionnaire I try to give it to. Now I'm giving my practices more into an adult population as such. I see most of them with these problems. They come with joint pains, they come with allergies and all that. The main problem is that they have a leaky gut. Leaky gut is a thing which is, I'll explain you much later also. This is because what happens is that you have got a thin membrane over the GIT tract. When it becomes porous, it becomes, some holes are there in that. This is called leaky gut. And once you have got a leaky gut, normal permeability of this thing it gets altered, and whatever food you are taking and all that, like gluten and casein and all that, milk you are taking, normally what the digestion occurs is, it starts from the saliva, it goes into the esophagus and the stomach and intestines and all that. So this is a slow process. This is a constant churning of things. It's a big factory, things and all that. From here, there's a lot of good for pH, acid, base, kind of thing. It's so tough. We went into physiology, second year medicine. We were absolutely, we thought, what is it? It's such a kind of thing. So everything counts here. What happens is that once you have got leaky gut and all, you start, there are some food particles like long-term peptides that has to be converted to short chain peptides. Then only it gets absorbed. When in case of leaky gut, the long chain peptides, they get absorbed into that. They get into the system and they cause a lot of delayed hypersensitivity reaction. Delayed hypersensitivity reaction is you have something like today you will not develop allergy immediately. You don't have anaphylaxis immediately. You will develop sometime 1 week later. You'll know, okay, your joints are aching. You have got some problems and all that. That was because thanks to your 1 week before what you had. Yeah, that's the kind of thing. These are all my markers. In fact, I give scoring answers. What are the scores patients give me? I give a evaluation. even I don't wait as such. My staff person, he does it comfortably, and he comes and tells, sir, your score is this much. So I know what I have to do for this guy. So this is a leaky gut evaluation we do. In autism, I cannot have that particular thing. I just depend mostly on my clinical kind of correlation. I have to keep asking the mother, father, what did he had, food. I have to emphasize a lot on the food. And some patients, they just go crazy. Why this guy is so much of the food and all that? But I got maximum results if I try to put across this food structure. If I do a proper kind of thing, I get maximum results. What is it? Why we are talking so much about this this autistic enterocolitis? Name any kind of colitis and all that. What is that? The problem is this is because of the inflamed gut. It's an angry-looking gut. It's like Amitabh Bachchan. It's a kind of grumpy kind of intestines, which is what is making this a gut inflamed? What is the thing? It is because of whatever things you are taking. I have learned a toxin from plant, which is called oxalates, which is causing all these particular things. So we'll talk about something about low oxalate diet also, and how does it oxalates enter the tissues. The thing is, oxalates, when you have got leaky gut and all that, they just enter into the things. And oxalate structure is similar to sulfate, and this is a kind of thing. And you have got a mucosal barrier here, the intestine, this particular thing as such, and this is the inside of the cell, the outside of the cell. So, okay, this is the. There is one more Dr. Barron here also explained what is the kind of role this particular sulfate and oxalate has to do. You will see the subsequent slides. Oxalates, when they are excessive, they start in the cell. They start giving the cell dies and necrosis happens. The cell apoptosis is there is a complete disruption of the cell membranes and all that. So this particular oxalates are causing this leaky membrane in the diet oxalates, and we have gone to a one step ahead also. We will not. I don't want to confuse the people as it is the free radicals, it's the heavy metals, whatever we are getting from the thing and such. They are also they can cause apoptosis and necrosis of the thing as such. Radiation, whatever things we keep telling, okay, just take a chest X-ray. Second day, second admission also, the same skin is being done in repeat X-ray. 5 days of admission in the hospital, 5 different X-rays were taken on the same part. You can understand what the kind of radiation is this child is getting exposed. With this radiation, apoptosis, DIT health, everything goes for a toss. I'm not trying to blame the mainstream people. I'm a radiologist because I know what is the kind of things and all that. So I have gone to that particular thing. Okay, okay. I feel that we need to limit. Okay, enough is enough. We need to limit. I have seen people. I have seen kids, prenatal kids. I used to work in a pediatric hospital. I have seen a 1.2 kgs of a kid who was delivered prematurely, was subjected for 1 month continuous X-rays. I need to still see how this guy is going to come up. He will have all hormonal issues, he will have all GA problems, everything and all that. That's what my kind of concerns and all that. Okay, let me go back to oxalates. What oxalates are doing is they are trying to damage the cells. Okay, when the cells are getting damaged, you have got the cell swells and holes appear in the cell. Okay, this exudes some material out of the cell, which can explain the increase in autoimmune diseases. These are all the autoimmune diseases which we are facing right now. We get paper cuttings telling that okay, this is on rise, multiple sclerosis. We have this is my 25th. Next year will be my 25th year when I joined medicine. When we joined medicine, there were no cases of multiple sclerosis. We had never seen. Now we are seeing multiple sclerosis. Now we are saying the kind of thing. So these are all the what I'm trying to put across is, in spite of all advancements in medical sciences, this autoimmune disease is still on the rise. Asthma, great, it's again autoimmune disease. Autism, all whatever I have listed here. Celiac disease is more common. It's getting here. Ulcerative colitis, we are day in and day out we are diagnosing ulcerative colitis. We used to think before that ulcerative colitis and celiac is the disease of West. It doesn't happen in India. Now we are convinced that everything can happen in India. Okay, coming back to what is oxidate which is causing, again I think this is the one thing. Oxidates can cause cellular distress and oxidative stress. Oxidative stress is the main culprit. We are all having problems because of oxidative stress. Oxidative stress is one thing. It is not the stress I'm talking about what your wife is giving you, what is your subordinates are giving you the stress. It is the whatever stress is the metabolic stress. Your liver is day in and day out, it has to struggle with the kind of toxins and the kind of things which are going into it, with the kind of we enjoy, what is the kind, whatever things what we are saying, we are just enjoying with the food and all that. But your liver is at the poor. It's a 24/7 work for the liver. Okay, and it's the maximum oxidative stress occurs at the liver. What happens with the kind of thing? I'll just give you example, small example. Why are we talking about this one asset? My other friends, when I started talking about autism and all that, they said, what is that vaccine? Why did it cause bad things and all that? Nobody is ready to listen to what exactly you are trying to talk. They said, okay, 100 kids have taken vaccine. No, only 2 kids has got one has got some asthma, one has got some into some problem, learning disability. 1% goes into autism. This is okay. Out of 1,000, 1% or 2 things are having asthma. It is acceptable thing. But what I feel is that is also not acceptable. Why I try to put across the reasons. The reason is what we are doing is whenever I want to put a kid on oxidative stress, I want to see that I want to the thing is, a children of premature or whatever at that age, if his oxidative stress at the liver level is more, like he has got a small infection, a subclinical infection, a fever also doesn't manifest at that time. Or he has something called paracetamol tablet was given as such. So what happens with paracetamol tablet is, and with this particular thing, your liver has got a buffer mechanism. It has got a limited role as such. You have got some glutathione levels in that. So all this glutathione gets depleted, dealing with this oxidative stress, dealing with the fever and all that. At that point of time, you are adding you are assaulting the child with vaccine or something like that, or a good antibiotic and all, with this one. This, whatever environment thing is there, mercury, whatever is it, you can take bisphenol, whatever is it. This child is not going to handle this. This child, this whatever toxic load it comes into it, your liver is not capable of taking up that. So the body has to do something. It gets it knocks up from the blood supply. It gets stored in the fat component. Fat. What is the fat component? It is the adipose tissues and all that. And brain is the maximum place which has got maximum fat. Okay. So that is what it happens if you don't have proper glutathione. So what I'm trying to put across is, it is the oxidative stress which is the main kind of thing, and it can lead to so many problems. It can cause mitochondrial damage. This is mitochondrial cytopathies we are talking about. Now this is the thing which I'm talking about, and try to decrease your stress levels. It's a become fashion now. I get some patient. Doctor साहब stress बहुत हो गया था. I had built a house. I had a heavy stress. I got diabetes. He's so cool. He's telling he's got diabetes just because of the external stress and all that, and he's not bothered about his internal stress. We need to look at that metabolic stress. It's the biggest challenge these days. We need to work for that. Okay, I'm coming down to leaky gut. I'll come back. This is my favorite thing. I still feel the leaky gut is a part. Everybody has got a leaky gut. Some people have got less, and some people have more. What happens is, what is happening is leaky gut. If your calcium is a saver, it tries to come and zip off the leaky gut and all that. So what happens? This calcium, two things keep away this calcium from reaching. Calcium it get tied up this one fat, maltodextrin fat. It can cause steatorrhea, and it can be bound by food which contains this one, as well as from the oxalates. So calcium deficiency is a part of kind of thing, autism access, and okay, leaky gut can be healed by different ways. We try to heal it by different ways as such, and I don't think it is under my purview. I'll try to limit my talk about general kind of things what I will try to put across. What is the low oxalate diet? Low oxalate diet has become suddenly all of my patients, I'm telling them low oxalate diet. I have just put a paper and just give it. My staff people give it. Okay, you need to follow that. They are scratching their head. What is it? Okay, these are the things, because once we started using this low oxalate diet, things started getting better as well. The thing is, there is a lot of controversy. There are some foods which in a specific carbohydrate diet is not legal, whereas in low oxalate diet it is legal. I'll just show you some of them assets. Even the milk substitutes, except coconut, and the coconut milk is only allowed. You cannot have other milk substitutes because they contain high oxalate. Almond milk, I used to tell them almond milk 2 years back. 2 years back, even 1 year back also I told, okay, you almond milk can give. Almond milk has got high oxalate levels. No almond milk. For my patients, absolutely. Now, okay, we learn from experiences. Whatever I have done 5 years back, now my practice is totally different. I had to admit that what I have been telling over the past so many years, it changes as such. Now, gluten-free and all that, it's a must. Along with that, we need to use this low oxalate diet also. What are the oxalate foods? You are aware of all these things. You know, rajma, chole, you have got spinach, you have got beans, you have got soya, chocolates, and whatnot. So you can just go to the low oxalate diet and you can just. Now I just want to tell about our parents and all that. Okay, we need to look. Food is not that simple thing. We need to look it as I keep telling. I was trying to tell in one of the medical meetings that the housewives, the women, they design their blouses, but they fail to design the diet for a specific child, and all the 5 members or 4 members of the family, they require different diets. It cannot happen. All cannot be having the diet is, believe me, it has to. You have to look at your blood group. You need to look at the other issues. Then you need to design it. Genetic individuality determines, and there's a lot of work on so many dietitians have done. I have one of I last time I was reading Ruchu Divakar's book as such. It has in fact one of the clearly it has shown why Punjabis can tolerate paneer paratha, whereas the Tamilian he may not digest that. So we need to see the genetic markers also. That idli and vada will be very good for a person from the south. So we need to see at this genetic individuality. I'm going to open up one more kind of thing which is called lectin. I've been working for this since some time now. In fact, I'm doing some weight loss programs also in Hyderabad. It's getting very popular here. I just do a diet which is devoid of lectins. Okay, wheat, corn, diarrhea, all these things you are not supposed to take. And then the thing is, what is happening? Why lectin is so important? Lectin is like tomatoes. Tomato has got very good antioxidant, which is called lycopene, but it contains this lectin also. Now, after reading all this, I'm going through all this. I just keep away this tomato sauce and everything and all that. I don't touch that. Okay, there are some good sources of lycopene also, which is watermelon, guava, and other things and all that. We need to look into this particularly. Why? What is it? Lectin? Why is it so? It is a class of protein that are found in common foods. They act as a sort of immune system for plants by sticking themselves to the structural carbohydrates. And okay, our genetic makeup, our blood group, they determine which lectins are sensitive for you or not. Okay, and it's important that many people will report that they do not feel any digestive disturbances, but it does not mean that lectins are not affecting them. These people can, it's cumulative damage. They may develop afterwards. When we see a gluten intolerance, we see on the kind of endoscopy the binding of glycolic acids. This is a sign of gluten atrophy. And this chap says, I don't have any problems. So the thing is, and what can be done for these lectins? Lectins are an innate thing. They keep coming. They keep coming. We need to see that there is something which is called lectin lock or lectin binding agents and all that. I'll name few of this, and this can help us. Okay, lectins damage the from the diet. They can damage the microvilli, negatively influence gut permeability. So what I've been talking about the oxalates, the same thing. It's there as such, and these are causing problems which are absolutely like rheumatoid arthritis. A person with irritable bladder. Recently I had one of the patient who comes after a prostate surgery, and he used to void every half an hour before undergoing the prostate surgery. After doing this prostate surgery, this gentleman is about 65 years old, and after the prostate surgery, he is in the same shape. This bladder is very, very irritable bladder. What the cause as such? Every time he goes past urine, he is not sleeping, everything and all that. I removed all the lectins from the diet. I try to give some kind of things. Now I try to add magnesium, so many other things and all that. I added omega-3 fatty acids, so many things. Now he is much, much better. What I mean to say is, your other organs also can get affected with this kind of lectins and all. This to food sensitivities. This food sensitivities, we may not pick up on the food allergy panels and all that, because this works by a shortcut method. These lectins and oxalates, they are causing leaky gut. After the leaky gut, so anything can be a problem as such. It need not be that the child has got gluten, he is not food allergy is negative, he is not allergic to food, allergy test is negative for gluten, but still gluten, because it contains lectin, it can cause damage. So I'm treating fibromyalgia with this diet. People are happy. Thyroid patients, I treat them with, I try to remove this kind of wheat and all that. They start getting better. And this dose comes down, and weight gain people on weight loss therapies, they need to stop lectins. What are the natural shield secondary lectins which we can use in our day-to-day practice? Mucins are the main thing. The mucins are being produced from the saliva, talic acid, mucin, and all that. The problem is we don't have time to chew that long acid. If we have that kind of time, we will not get into all these problems. So the moment even thing is, whatever mucins we can get it from outside. Saliva contains mucin, and mucin protects against yeast, bacteria, and food sensitivities because it has got lectin binding capacity. It contains the sugars that lectins like to stick to, including salic acid. And other lectin binding agents like N-acetyl glucosamine. I have the thing called gourd, which is called guar. We used to sometimes we used to make sweets out of that, gold colored or something like that. This is a very good, contains good kind of lectin binding agent. Bhindi, what we call Okra, Bhindi has got excellent mucoprotective. All my diabetic patients all are on Bhindi now. This particularly it helps in producing good mucus and all that. Mind you, this Okra is SCD illegal, but I don't care a damn. I want to take the best out of everything as such. But this particular is giving results as such. Colitis patients, ulcer patients, other patients, this can absolutely try to do this particular when it comes to healing the leaky gut. This is instrumental as such. I don't want my patient, everybody of autism parents are how long I have to continue the diet and all that. People are very exhausted. So if you see that the gut heals within no time, fast as such, by avoiding antibiotics, by avoiding giving good probiotics, giving this kind of lectin binding agents and all that, we can see that the gut will heal within a year or two, and you can always go back to your these things as such. Sodium alginate is one thing I have been trying since some time. It is it takes out mercury also. It is a good soluble fiber, and it's very simple thing. It's derived from a seaweed, easy to get it, and it's a good one. Nobody has tried. I have trying with some of my kids and says they are doing well. What this lectin binding is doing, and it's promoting weight loss. It is restoring proper weight balance, achieving healthy joints, reducing inflammation. Inflammation is the main thing. Inflammation, every problem is because of chronic inflammatory states we have got. Be it intestines, be it arteries, be it neuroinflammation. Every problem is with inflammation. We don't know what is the cause of the inflammation. We feel okay. This may be the cause. This may be the common mainstream doctor. When I keep interacting a lot with these people because I still practice my radiology. I do interventions and all that. I keep probing this gastroenterologist and all that. So they say inflammation. Inflammation. The moment they say, they tell it's only they need it. The patient needs antibiotic. Or the next one, it's anti biotic or it is antifungal. The thing is, inflammation can be caused by metals. Inflammation can be caused by oxalates. Can be caused by lectins. We need to look at this kind of things because just putting on more antibiotics and all that, it's not going to solve the problems. Lectin binding helps in repairing the digestive tract, facilitating healthy detoxification of the liver and gut. And okay, this is the kind of thing we need to add these things, guar, xanthan, whatever is commercially available or whatever you can innovate and all that. Coming down to diet, what are the diet acids? We keep talking about trans and cis fatty acids and all that. The moment I was being talking to one of the group acids, and I told them, okay, there is no kind of things about. I always believe this biomedical kind of interventions, whatever we are giving. See, what we are trying to put across is a child comes to me with autism. The first thing I'd like to see is his eye contact. Eye contact is very poor. I put him on cis form of fatty acids. Cis form of thing. It's a vitamin A, cis form of vitamin A. The moment I give it, within a week his eye contact develops. So the problem here is all the medical kind of things, whatever we are getting. Now there is a trans fats, trans is more. It's more cheaper, it's more. The cis fatty acids and all that, it's rarer to get. So I always try to put across the kind of cardiovascular morbidity, the kind of other problems we are getting is because of the abundance of trans fatty acids, and these trans fatty acids are causing a lot of problems because they go in the wrong places and get stuck. There is no way our body can use that particular trans fats. Even if we use we feel that, I have taken once in a week, I have taken that one, chalta hai. That chalta we have to take out. No ways. It's not, we are not, this is a kind of thing. This is one thing I'm just trying to put across. If you try to see the labels of all the food products, try to see the trans fat, what is the value of trans fats, and limit it. Okay, and limit fat intake to about 30%. Yeah, please don't cut the fat total intake together. People are coming to us, all the cardiac cases and all that. The people are totally on zero cholesterol diet. They just look like a famine-stricken people. They just their whole the charm is gone and all that. The thing is, these people, when you curtail all your kind of things, there's a thing. Cholesterol is also essential for you. You need cholesterol to have a good set of hormones and such. All my patients who are put on statins and all that, they are totally depleted. You'll be surprised if above 40 years age group, the testosterone levels I keep doing, in females also we have got. This is the curtailment of a good fat is the reason for all these hormonal issues what we are facing presently. People are just getting into this one, depression, because of the hormonal issues. You get into all these problems because you don't have a substrate. You have to have a cholesterol which is proper. Then other things can properly. It's a big thing as cholesterol and all that. It's all precursors, pregnenolone, then DHEA, then testosterone, then progesterone, and all the things. So I think most of our kind of thing, people are health-wise, they are making a lot of big sacrifice by cutting down this fat. I don't want any of you should cut down. You try to take a good fat, which is the cis fat. Try to focus on more olive oil, canola, all these things.
Coconut oil.
Yeah, coconut oil is absolute, fantastic. Coconut oil
Can you
is,
talk something about eggs?
eggs. I love eggs. I take 2 eggs in the morning. If I get time, I can take eggs in the lunch also. And I take egg yolk also. Basically, egg has got a yolk and it has got legs within. And in fact, the thing is, I don't know what has happened to the in the media and all that. It's a bad publicity. The thing is, your liver is capable of producing, even if you're not giving any fat to your body, your liver is capable of producing fats, triglycerides, LDL from the carbohydrate substrate. So whatever endogenous cholesterol is there, 10% comes by exogenous, 90% is endogenous. So endogenous, yeah. Lecithin, and there's a thing called sphingomyelin. There's a thing called there's one more thing. I'm not phospholipids. They are good source. It's available only in the fat. This X, all that. If you take that, you are in fact. I feel it's essential for you. They clean up your fat. They clean up your bad cholesterol. Coconut oil, yes. Only thing is we don't get a proper source of coconut oil here. And another thing about coconut oil is this particular MCT. It contains medium chain cholesterols.
Fatty acids.
MCT, MCT is the term. And if you take this kind of stuff, you're not going to get cardiac problems and all that.
I have too want to cut down, but a lot of the autistic kids cannot tolerate eggs. Even my son.
Yeah, there is again the food sensitivity as such.
Yes.
Egg also is one of the food sensitivities and all that. And now I have switched over. I'm talking for my the parents as such.
Okay.
We need to look at their health also. We need to somehow I felt because you unknowingly you neglect your kind of thing. X I think I try to give it for the autism patients. If it's helping him, I continue. Otherwise, I try to avoid that.
Yeah, I think the gut has to be in a very good shape even before introducing egg.
Yeah,
Yeah.
absolutely, absolutely. And other things, omega-3 fatty acids. All of you know about fish and flaxseed and all that. Flaxseed is a good thing. The problem here with consuming fish in Hyderabad and other places is we had done a study with Nizam College. I was also instrumental, and there is a department of zoology from these people. These people have in fact done a study. Have you visited Hyderabad? I don't know any of how many of you visited Hyderabad. There's a beautiful lake called Hussain Sagar Lake. Okay, all the fishes which are from the Hussain Sagar Lake, they are potential carcinogens. It has been documented.
Wow.
So yeah, in Hyderabad, I'm scared to take fish. If I get salmon, I take out the skin of the salmon, then only I take the fish. Otherwise, I don't take any other fish because we are not sure which contains and what. And the regulations here are you need not. There is no regulatory body here as such. We don't know what is what as such. I will come out to one more interesting thing which is called vitamin D. What is happening here? It's a mandatory. Any diabetic patient of mine, he has to sit in the sun, midday sunlight. He knows. The one person tells the other person, Doctor Garu, he has to sit. 11 o'clock to 3 o'clock time. He needs to have at least 20 hours of sunbath, 20 minutes of sunbathing. With that, the vitamin D levels, 125 dihydroxy vitamin D and all that. If these levels are maintained, it is an insurance against all other problems as such. Your prostate, your breast carcinoma, all the thing is somehow we are in Hyderabad now we are saying vitamin D levels also we are trying to pick it up. Huge, there is a downslide. People have got low vitamin D levels to the tune of less than 30 times as such. So we need to see this is also one of the important prescription. This is the vitamin D supplementation by sunlight exposure is my third or fourth prescription to almost every patient. All cancer patients they get this one,
including autism community.
Absolutely. This is slightly. I just try to. I think it was a monitor. Heavy metals, yeah. Yeah. So
Good. This is very interesting.
I think you people enjoy this particular side.
Yeah.
Hello.
Yeah.
In fact, I was trying to end this particular food sensitivities and all that. I can talk for another 1 hour about food sensitivities. I will do one thing. I will try to come back fast to this particular relation therapy. What I've been doing as such. It is very pertinent as such. What I'd like to just have I think we have another 5 minutes.
Yes.
Yeah, I'll just try to finish off. Basically, when we are talking about hazardous substances and all that, arsenic, lead, mercury, now we are getting everything here. There's no dearth of it. You go and buy something, you get one free assets. DDT, still DDT is found in the breast milk of the things here. You get all benzene products, all cadmium and all that. What I feel is that these are the 20 hazardous substances: arsenic, lead, mercury, cadmium. These are the things. This is the cause of most of our problems. We were only pinpointing mercury as such about this one. Cadmium is causing breast cancer, cadmium is causing prostate cancer, lead is causing so many things as such, hyperactivity disorder, arsenic is causing diabetes. So we now as a team will toxicologist, we are, okay, I'll just go back, what is it, what we are taking and all that. This is from a Mumbai market as such. Whatever chicken you are taking, the mercury is way ahead, 8 to 10 times higher. Lead is 2 to 24 times higher.
Wow.
Okay, these are the things as well. Lead, so whatever food you are taking, chicken, we are taking prawns and all that, we need to look at the kind of thing. Mercury levels also fish advisories. I was been talking about that. One of my, there was an environmentalist, Mr. Ashish Srivastava, he's no more. He has done excellent work. He tried to put across everything as such. Or the cause of, he has put sparely on the mercury as such. And even Sunita Narayan has also contributed a lot. And we need, still advisories are not available here. They have worked in this, Mr. Srivastava has worked in 2000. He's no more. And it's a great kind of work. And we still are into that same kind of thing. Thermometers are just thrown out like that. The CFL bulbs are thrown out like that. You can imagine what is the kind of pollution we are getting, the mercury and all that. And it's a simple thing. It's the government is just allowing the CFL production like anything, basic disposal and all that. It's literally killing us. There are so many things. The kind of diseases which are what we are getting here. We not again coming back to Ayurveda. A great cricketer, he says, Sona Chandi Chayanprash, you take Sona Chandi Chayanprash. This is the kind of thing he is telling. I have great regards for Ayurveda. I feel that it is a fantastic thing. But the thing is, the times are changing. At the time when Ayurveda was there was no heavy metal intoxication. There was this kind of environmental pollutants are on a big time now. We are day in and day out, we are working against this particular thing. At that time, maybe gold, or lead, whatever is it, arsenic, in a small minuscule quantity, it might have helped people. But now again, if you are giving, already your system is full of lead, you are full of things and all that. The moment you add this one, your kidneys goes for a toss. I have seen a lot of kidney failure. A 25-year-old comes with a kind of vomitings, hypertension and all that. You see his ultrasound, you check his kidneys, it's renal parenchymal disease, bilateral chronic renal parenchymal. The cause is he keeps taking all these particular things. He keeps stopping all this. Okay. The thing is, we need a regulation. We need a regulation about this particular thing. Asthma, again, we are going to thing as such. Dumping rose. This is a horrible state of affairs. Lead in paints are still there. I had to really, I'm telling you, for my house to go for a paint access, I had to wait for 6 months. Now the budget has got some good paints and all that. Now whatever paint, last Diwali where we have painted, it was lead free, mercury free and arsenic free. Lead and mercury free. Okay. Still all the other brands, I had to search for 6 months. I didn't get a proper brand which is free of lead and all that. Lead in the paints is a big issue. China, this one, the toys from China can kill your the thing as such. Toys, it's a big scam. Again, coming down to the uh, best part of thing is we are just along the Ganges, the kind of pollution levels, what we are saying, high levels of cadmium, lead, and chromium find in the people near the Ganges plain. The carcinomas are on the all-time high. There's bladder cancers are on all the high time as such. The people, this is the kind of work we are trying to highlight about. This is all comes under clinical medical toxicology. The rise in gallbladder disease under focus. There is a kind of thing, gallbladder stones and all that. They are seen along the places where high levels of this metals are there as such. So along the ganglionic plane, the gallbladder disease is more. We need to look why this is it a casual phenomenon, or is it a kind of we need to look into it. We have been trying to go across to the ICMR. We have been trying to tell the people. I have been personally. I have went to a bigger organization. It's a governmental organization. It's called National Disaster Management Group. I had told about this kind of thing as well. And there's a big red tapeism. The government requires, they say, okay, Dr. Saxena, you try to do a 6 years study, and you take some cases who are vaccinated, some or not vaccinated, then we will think of that. What does it mean? This is all. At a personal level, I cannot take it. I have stopped visiting people as such. Now, my next target is directly telling the people. I have tried targeting the pediatricians and all that, but it's all blind. They have purposely, or they don't want to listen or something like that. I'll take up this issue in a bigger platform. I'm just waiting for my time to come. Because this enough is enough. These are all environmental hazards which are being. We are in fact what we are doing is we are trying to the kind of assaulting the immune system of the child. We are giving vaccinations and all that like that. I want all of you should try to join as such. Try to tell, okay, open up a wide. When we are talking about to the minister here, Amrita Samari, he says no, the WHO has already given the guidance, we are following that. So why there are two standards between other and here as such? Absolutely, I feel it pinches me the number of cases. I'm getting 2 or 3 new patients every week. I don't want to see any further autism patients. It's not that easy to treat one autism patient. I'm absolutely when this thing can be prevented. Why the hell we are not doing anything for that? I want everybody, Dr. Gupta, and we will definitely work a lot for this particular thing, Doctor. This is the thing.
We are there,
Yes,
Dr. Saxena. I personally feel we need a lot of research papers, and we need media.
No. We cannot wait for the things to happen as such. We have to take a step, and the thing is, it's a kind of. I had spoken to a group called Medically Aware Responsible Citizens of Hyderabad. It's a group of all scientists and all that. The top-notch people were sitting there. I spoke about autism and vaccine, and everybody accepted. They said, when this is the kind of thing, you can always go to the government and say. And I have been telling since last 4 years. Okay, I couldn't reach the particular top ladder as such. But the thing is, what I am concerned in India is we cannot afford to have an epidemic of autism in India. And the trend, the way the trend is going, it is either learning disability or ADHD or autism or asthma. All these 4 or 5 things are increasing like anything. And you know what is the kind of things we are giving. We are still giving. The last week I got a diabetes, infantile, juvenile diabetes. The father is coming, and he's showing me 7 years doctor is there. She has got an infantile, juvenile diabetes. It is the thanks she got a juvenile diabetes because of her hepatitis B and hemophilus HIV immunization. Okay. But the kind of thing. The thing is, what I'm trying to put across, safe vaccination is not yet clear, and we are still practicing the age-old medicine people are not aware of thymus or free vaccines. Very few people are aware. I can tell 90% of the pediatricians, practicing pediatricians in the city, I'm not aware of the towns and all that. They are not aware what is thymus or is it a problem they say. Very few people are there who knows, okay, yeah, this is something called mercury free vaccine also is available. And they don't even give an option to the child, the patient, telling that you have got two types of vaccine. One is mercury, another mercury free. And the mercury free, it comes at the cost. If you give the option to the patient, let him decide. This kind of thing is has to be okay. I think I am going to kind of thing, but I am very emotional about this. I feel that prevention is a better more kind of thing.
But then according to Dr. Saxena, you know, you being a parent, I completely understand that, and we want to support you. What is the thing you think that we can get this movement started? Because even parents have to take an initiative. It's just not the doctors.
No. The thing is, parents has to be taken an initiative. The thing is, it has to come to it has to be a bigger issue. As what is happening is, all the TV channels are telling, go and take polio vaccine, go and take hepatitis B vaccine. If I am telling, okay, Amitabh Bachchan is coming, your polio will get here. The bullshit. This is oral polio vaccine. You are producing more problems with the oral polio vaccine. We don't have injectable vaccine here. The thing is, I do something, maybe not now or sometime later, but I'm sure I'm going to create a big uproar about this. This is not a simple Coke or Pepsi issue. This is more important. We are generating we are making a sick generation through. We are answerable to the generation later.
I agree. Sorry to interrupt, Dr. Saxena. I agree with you.
Yeah.
I agree absolutely with you. But see, the strong lobby of pediatrician and the strong lobby of medical fraternity and strong support by UNICEF and WHO and the media for the vaccination.
Yeah,
But what am I?
People.
Absolutely. My point is that in the midst of such a big awareness, and that's what I could see even the DAN conference when I was in Dallas. The people were talking about how the pediatric lobby is so strong. So my point is that we keep on doing a good work, but simultaneously to enhance our advocacy, we need to come out with certain documentation and certain work to show that this is causing the damage.
I agree.
Yeah, Dr. Gupta, the thing is, the people who has done the DAN group thing and all that, they were at least successful. Now there is no mercury vaccine available in US.
Still, Dr. Saxena, I tell you, when I was there for 5 days, I could see still the misery in those people who were working. Still they find. I was so much opposition from the medical fraternity.
Yeah,
Absolutely.
H1 and N1, people are boosting H1
Something
and
keeps on
N1.
coming. Something keeps on coming there also. It's like still the people.
But
it's not that they're very comfortable. There's still so much of opposition from the medical fraternity and the pediatrician lobby. And it is.
But still, research is going on. Research is constant.
Absolutely.
Dr. Gupta, I gave a 1 hour talk to the pediatricians in Aditya Hospital, and this was attended actually. At the end of the time, after the 1 hour talk, the pediatrician, the owner of the pediatrician, Dr. Yadya Gabbard, he said, in my hospital, I want all mercury-free vaccines. He made a dictum. Okay, it is a tough thing, but somehow
I do agree, but such pediatricians with such mindedness are a rare breed, I can say. Mark, it's a very rare breed to get. But we need to continue in the momentum. But if we can come out with certain, what I mean to say is that to show to the world, even like the way we have the articles, the way you have shown all these articles.
Yeah, you see this particular HLL faces toxicity charges.
Absolutely.
The kids from all. Have you read the things as that? The people, they have come with neurological disorders, congenital heart defects and bleeding gums, 5 kids and all that. And these people, they were working for a HLL factory, which was taken as a glass factory, and they were preparing mercury thermometer there. Okay, and the Supreme Court also gave a compensation, and still they didn't get any kind of thing till now. So what I'm trying to put across is mercury can cause anything, congenital heart defects, it can cause leukemias, it can cause neurological defects and all that. Our Amudas, this guy also, he has went on record. He said it's a heavy metal intoxication is important issue and all that. Okay, but he's now the ex-minister and all that. Okay, but things are slowly trying to get. We need to come in a more proper way, so that at least vaccines should be very free. Vaccines, dental amalgams, Ayurvedic medicines, good environment. This is one thing we can always. These are all into our hands as such. We can.
But Dr. Saxena, my argument to it is that I do agree that all these dental amalgams, vaccine, all this should be mercury free. I do agree. But to convince this big lobby, like people are like something like a nicotine only, like tobacco only. Now why, unless we don't come out with certain data from Indian context, my point is that we will be out. We will be just.
Dr. Gupta, it will be too late. I cannot.
No, we have to simultaneously work. We have to simultaneously treat kids and simultaneously do it.
Absolutely.
Yeah.
We
cannot
continue doing that.
wait for research.
Whenever the parents come and say, please go for mercury-free vaccine. Whenever the parents ask us, we say, please go for mercury-free vaccine. Please read everything before you do. Please do these things. And simultaneously, we do the advocacy and lobbying and with some research and few research work. And then a lobby becomes more stronger, and then we can put our feet down. Then we can involve some personality, media personality.
Sorry. Yeah, that's true. That's a good suggestion, Dr. Gupta. I think we can always work on that, because we need to create a kind of thing, forum or something like that, and we need people who are definitely the parents. What I felt was I am dealing with more than 120 parents here, but what I see them, they are most of the times they are not able to take out the time out of their schedule and all that. It's become so taxing for the parent with autism to deal with a child, to get with going to the job, other things and all that. We need to get people like, I'm talking about people like Ramdev Baba. I'm talking about, yes, I'll definitely try to approach this guy and tell him that, because these are the people who I told about Andy Wakefield. This guy is a giver, you know. We need to look at the people.
You cannot compare Dr. Andrew Wakefield and Dr. Ramdev Baba.
No. I'm talking about Ramdev Baba. He's a very smart manager. He knows how to put across things and all that. That's it. I want people like this who can propagate our kind of theory. If this guy says, don't take vaccine, people will not take vaccines here.
But my point is that to make them convince.
Even to convince Dr. Ramdev Baba, he's going to ask for some papers and some documents.
He's not a doctor, man.
Yeah. Sorry, doctor.
Okay. Coming back to
okay, I think let's open up the questions. If you're done with the presentation, let's open up the questions. If anybody, if anybody have questions, they can raise hand and I can just unmute them, because if I unmute everybody, there will be a lot of echoes. People who have questions, they have to please raise their hand.
Manisha, can I ask one or two questions, Dr. Saxena, which can help the whole group?
Yeah, sure. Please go ahead. Yeah. And
two questions.
you can also share your experience about that conference. What did you feel with the doctors there, with the parents there?
Correct. Let me first ask a question and then I'll share my experience.
Sure.
No.
Go ahead.
Yeah. Dr. Saxena, before this underlying metal toxicity, heavy metal toxicity, are you doing any specific test in Hyderabad, or are you sending the samples to states, or how you are trying to find?
Dr. Gupta, what I was doing was, I was trying to check the hair and nail mercury estimation. It's done in Hyderabad itself.
Okay.
And now I have come up with something called copper and zinc also I was talking. Now I have come up with one more test which is called urinary pheromones. This is Dr. Brad Six and all that are doing more research with this particular thing. It's called porphyrobilinogen. It's a very simple thing. You have to test the urine and you know the metal load of that. And again, one more thing, the kind of socioeconomic strata what we have in Hyderabad, the kind of parents what I have got, I don't tax them with big investigations. I tell, for me, clinical improvement is number one. And okay, I take care of other things. I take care of serum creatine, liver, LFTs. These are simple things. But somehow I feel that I not I do chelation therapy in a different perspectives, Dr. Gupta. I do something called, I believe that skin is a good detox. For a kid of 2.5 years or 3 years, I don't give him a IV chelation at all. I give him something called far-infrared sauna. I make the mother as well as some father can sit along with the kid, and along with that I give something called ozone therapy, which I give along with the ears and all that. And I try to reduce the oxidative stress by giving all the. I try to mix out things. I give magnesium, a lot of magnesium. I give a lot of things and all that. Again, I definitely like to look at the results. I like to go for all the kind of things and all that. But the problem is with the socioeconomic strata. The thing is, these people are already drained their kind of the economy.
So you don't put them in any sort of a DMSA, DMPA or EDTA, nothing
Yeah,
on those things.
I give DMSA, I give DMPS, IV DMPS. I not like to give it. All DMPS is not, it doesn't suit as such. I'm giving with alginates. Alginates are doing well as such. And
Alginate, sodium
tell
alginate.
them, sodium alginate. I tell them to go for a lot of natural chelators, Dr. Gupta. I
Such
tell
as?
them to go for natural chelators a lot. You have got garlic, you have got
Cilantro.
ginger is a natural chelator. You have alpha lipoic acid. You have got cranberry. So many things as such. Natural chelator, I emphasize a lot on natural chelators. And what do you call this one as such? You need to keep on doing. The best part I try to pick it up is I give a multani mitti bath. I ask the parents to give a multani mitti smear all over the body. After that, after half an hour, they just give him a bath. After that, they come down and sit in the sauna, and this works like anything. I have people whom
It helps in
I
chelation.
don't have.
It helps in
Huh?
Multani
It's
mitti.
chelation. It's a chelation.
It's a transdermal chelation, you can say. But you know how good is that? How is that tested?
I think I'm coming down to the slide as such. You can always see that particular thing.
No, how tested is the multani mitti? That's my worry here. Is it tested?
Yeah, the thing is, it's the bentonite clay we don't get here. We don't get
Bentonite clay, okay.
Yeah, bentonite clay is good as such, but again, some magnetic clay is also good.
Yeah.
And multani mitti is a cheap kind of thing here. And this is the kind of thing we see in the patients. We use we have our indirect markers and all that. Your bathtub also will show you that some kind of change in colors and all that. This is all what I'm trying to put across. People who are very scared of chelation, the moment they say, see, I give EDTA, I give calcium EDTA, I have got over the extreme, I have got, now I'm working with zinc TTPA, which is, it's slightly costlier option, but it's a 5 minutes push as such, and it doesn't cause any problems and all that.
From where do you get the bentonite clay?
Bentonite clay, it's there in the thing as a literature. Magnetic clay and bentonite clay you can order online.
Okay.
Yeah.
Okay. So I think there's one parent who wants to ask a question. I have
You can see if he's right particularly. Heavy metals are positively charged.
Yeah, I'm seeing that.
Whereas clay is negative charge. This is the kind of thing.
Please.
I'm just trying
Yeah.
to
Go ahead and ask the question.
Yes, sir.
Hello. Yeah, just 1 minute. Anshu Rathi, right? Can you please ask the
Sure,
question?
name is familiar.
Yeah,
Mr. Radi?
I don't know. Okay.
I think,
Okay, I have one more. Let me see.
I think we will allow Dr. Gupta. He was trying to tell something
Yeah,
about
yeah.
the previous
Go
guy.
ahead. Go ahead, Dr.
Yeah,
Deep.
I'm practicing as a child psychiatrist in New Delhi. I'm at Gangaram Hospital, and for the last 2 years, I've been into biomedical with children with autistic spectrum disorder. So I work only with autistic spectrum disorder, and gradually my interest, and then finally I landed up in a DAN conference in Dallas, Texas. Before that, I started doing it, and then after I went to Dallas, Texas, I learned a lot of new things about how the diet is so important, how the various antioxidant, oxidative stress, which you were talking about, Dr. Saxena, is so important, how the inflammation, immunity, and how the toxins are really affecting children with spectrum, and why there could be plausible reason why the things are becoming more and more, the spectrum is coming up. So my faith in biomedical has become really increased. You know, my faith has gone up really high. And whatever parents, I must be having had 40 to 50 parents who are on various biomedical regimes. And very soon I'm presenting a paper in the AIMS conference on MP2H shots also, which I've been using now with the support of Akil Autism Foundation, Dr. Kadeem Irani. You know, and I've seen changes. You know, I've seen innumerable changes in various domains in children, from diet, from omega-3, from various supplements, and zinc, and MB12 shots. And I feel yes, what you are recommending about chelation, and I feel yes that will be my next step, which I'll be going up to do it. And I think yes, it is making a difference in kids, in children with spectrum disorders. I don't know about other conditions, but yes, my knowledge is limited to spectrum disorders, and it has got really reinforced and really more enhanced after the Dallas conference with the support of Akil Autism Foundation. That's what I can say in few words.
Yeah.
Yeah, that sounds great, Dr. Gupta. I'm
Yes.
really happy. Yeah, this is good. And are you? I'll talk to you in detail once. I think
Yeah,
parents.
Mr. Ratan Singh, you can ask a question.
Yes, thank you. I just want the email ID of Dr. Saxena and his telephone numbers just in case some of
Yeah,
us
you
want
can go to my website.
hair analysis.
Yeah, you can go to my website healthyheart.in, Mr. Ratan.
Yeah, wait a minute, please, slowly, please.
Healthyheart.in.
Thank you.
Yeah, and in Hyderabad we do these heavy metals from. There are 3-4 centers who has come up. One is Vimta Labs, another one is Dr. Lal Labs. Hello.
Right. Yeah. So
Yeah.
all these addresses we get on healthyheart.com.
No. Healthyheart.in. This is my personal website. You are not going to get .in, wherein you will get my email ID. Yeah.
Oh, I will get your email on this side.
Yeah. You can always have a look.
We will email you all the details, Mr. Ratan. What I will do is I will email you all the details of Dr. Saxena. Do you yeah.
Do you do hair analysis?
Yeah, we do it in Hyderabad. Vimta Labs is doing that. Hair analysis is being done here.
What about the food allergy testing, Dr. Saxena? Do you think it is worth doing a food allergy testing?
Food allergy testing, definitely. We used to tell the people to go for it. That basically, it was costing is slightly about 10,000 and odd. You need to spend that. The only thing is, some of my parents who got this testing, then they said, okay, the problem is that the thing is, what if we have been talking about leaky gut and all that, everything doesn't come on the food allergy panel, you know. So if your child, if the parent says my child is not allergic to wheat, why are you stopping the wheat?
Okay.
Answering them
Yeah.
will be different thing as such.
That's even I've seen in my practices also. It doesn't come and then parent
The thing
becomes, yes,
is,
we should not.
yeah, most of people will be the grandparents. They are not ready to listen to us.
And we don't know how specific they are to the brain.
No, the thing is, if we tell, now I stopped asking about food allergy test because it backfires you. That's the problem.
Absolutely.
Okay. Mr. Sanjeev, you can go ahead and ask the question.
Yeah, good evening.
Good evening.
Yeah, good.
I would like to know that about what lead has a role to play in, autistic children.
Absolutely. Well, Mr. Sanjeev, lead causes more of ADHD syndrome. In autism per se, you have got a component of attention hyperactivity deficit disorder. So this attention hyperactivity is the process of lead as such. I believe it is in that way. Because what I have done is, most of the autism patients, if I remove lead, the child is very, very hyperactive. He is not responding to any other thing. He will respond by taking out lead. Because what happens
Because
is
my daughter, I checked the levels of lead in my daughter. It is 27 microgram per G or whatever it is. Reference range is 5 and she's 27. So is it too high or?
The thing is, Mr. Sanjeev, you should know about two particular things. Did you go for a baseline check, or after chelation did you check it? Because what happens
It is
your
checked in
baseline,
USA. It's urine toxic metals.
yeah, it is. I think a challenge test was done or without that? Challenge test was done. Challenge test was done.
Challenge
there is
test, I'm not.
The thing is, what is done is, you can just have a normal urine metals, or you can always have it when you give a chelation therapy. After that, you check the urine levels. So if your child has got 27 before this one, I think you should give it a try.
Yeah,
So
it's
you
high.
should go for calcium EDTA. You can, which part you try to get in touch with Dr. Anju's one should help you.
Yeah, you can get
Okay,
in touch
I'm-
with you can get in touch with me, and I will be we'll be able to help you. Where are you? Are you in US?
I'm listening to you.
Okay, are you in US or in India?
No, I'm in Tamil Nadu actually. I'm in India, but I did the test in US.
Okay.
Because
you can
Dr.
always
Who's
contact. You can once you have my email ID. I have my two
Yeah.
friends, Dr. Arul and Dr. Shiv Malan. You can get in touch with them. They will help you out in Chennai. You don't have to come to Hyderabad also.
Okay. Okay, I will email you and keep in touch.
Yeah.
So let's see.
Immediately.
Yeah. Okay. I have another parent who has a question. Anil Pambani, can you
Thank
please?
Yeah. Good evening, ma'am. This is Anil speaking from Bangalore.
Yeah.
Dr. Saxena, if you recollect, we
Yeah,
had
hi,
this,
Anil.
about 5 years back. How are you?
Anil, I'm fine. How about you, Anil?
Great.
How is your son doing? Okay, good.
Is well, I just want to check if anybody in Bangalore who could help us with follow-up on this.
You can do one thing. You can get in touch with Renuka Anand. She can give you. Your son's name I'm not remembering.
Ayush.
Ayush, yeah. Ayush. Did we start ozone therapy for him?
No.
Ozone.
No.
You can
No,
get
we
in
did
touch
not do
with ozone.
Okay.
Okay.
Oh,
Yeah,
who's
you
the-
can get in
who's the
touch with Renuka Anand.
Okay.
You can just, you can mail me. I can give you her, I can SMS her phone number. Yeah.
Yeah. Oh, I'll do that. I'll mail it to you down. Mail it to you directly.
Yeah. Okay, it was great to listening to you. And difficult. Yeah.
Yes. I'll get in touch with you. I'll speak to you directly. You're
Sure.
on the same mobile number.
Yeah.
Okay. I have one more. Again, Mr. Rathi, are you there? You want to ask a question? Okay. Yes, Mrs. Sanjeev. Mrs. Sanjeev, do you have another question?
Hello?
Hello?
Hello.
Yeah.
No, you said in Chennai there is a testing facility, right? Do they have the
You go to
testing facility also?
Chennai Vimta you go. Chennai Vimta.
Excuse me? Vimta.
Vimta Labs in Chennai. Yeah, they will do this.
Okay.
Yeah.
Okay.
I'm not. These